I have several conflicts of interest also in this presentation, so take it into consideration, please. My issues are very simple. Some controversies in alopecia treatment. If oral supplementation of antioxidants and vitamins should be given, and the low dose cytokine therapy, which is probably the future, also in hair regrowth and hair lifestyle. First of all, controversies in alopecia areata, finasteride. Then few words on synthetic hair implant, and then minoxidil treatment. Well, finasteride, we are probably at the end of an era. Maybe that you know that there is this foundation. This foundation started a very big issue in the United States. This big issue is bringing to a class action and is involving millions of patients who used treatment of finasteride. I don't know where this will bring. This drug is approved by the FDA, it's clear. I don't think that there is any ground behind this kind of claims. Nevertheless, this is the present. And this foundation serves as a central resource for published research on the condition and so on and so on and so on, and mainly is bringing a lot of news. Some are fake, some are good, to the patients. Doctors are not involved into this kind of foundation. They say that devastating, this is what they state, sexual, neurological, and physical side effects that persist in men who have taken the finasteride, and this is also absolutely applicable to the other types of alopecia and generics. And there is now this new trend on the common persistent side effect of finasteride, including erectile dysfunction, depression, and suicidal ideation, anxiety, panic attack, Peyronie disease, muscle atrophy, severe skin dry, tinnitus, insomnia, and so on, and so on, and so on. What will be the future? The future will be that most probably we will continue to use this excellent drug. Nevertheless, we will be always chased by the patients. Maybe we will be the victims of class actions also in our countries. So we should know that beyond an approved and safe and efficacious treatment, there is a trend which is out of our control, absolutely out of our control, of which we as doctors could be the victims. So keep this in mind. You can lose your patient, and more than that, you can be involved into some legal action that are not fair, behaving as a good doctor. I would like to say 2 words on the biofibre polyamide hair implant. You know that there is a long story behind this, and this is still considered in the United States an infamous treatment. Infamous. I think, and you correct me, that this is the only device which is banned by the FDA. Only this one. I don't think there is another one. So, I don't know, you name the devil in your country, this is the devil in hair transplantation. Nevertheless, this paper is a paper in which 11 universities have been involved. It seems that it works well, there are no side effects, and it's just a question of reconsidering this kind of issue. Here you can see this paper was published in 2015, And here you can see the data of the study. I have no time to go around and to go in depth, but only 3.8% presented some inflammation, and it was mainly related to the use of wrong chemical substances. Here you can see that there are no rules, and there are no scars, no problems, because there are no donor areas. And this is bringing to another paper, authored by Professor Chen, me, and many others, with another study. And this is another paper again on the impact of quality of life of this biofibre. And it seems that this polyamide artificial hair implant is one of the current techniques used to treat this problem and improves quality of life of patients. So, at the end of the day, this is, as far as I know, the main company working on this field. There is another one from Japan. And in the European Union, this is approved by the European Union, and there is nothing against the use. Each and every doctor can use it, and results are good. There are obviously indications, and obviously there are contraindications, which are not very many, but you can see mainly psoriasis of the scalp, of folliculitis, of autoimmune disease that should be treated before going further with the treatment of biofibre. What to do for a successful implant? Well, suitable instrument and qualified doctors. And then obviously they start with the tolerance test, and then after 200 fibers, if the patient is suitable for the treatment, after that there are the blood tests, there are the implantations after 3-4 weeks, and usually there are no more than 50 fibers per square centimeters. Implantations are up to 1500 fibers. This must be the orientation, 15 degrees, distance 1 to 2 millimeters, and this is the area of implantation. You see there is a sort of makeup, and this is at the end how the patients can see the results immediately, and how the aesthetic result and the psychological benefit is good. Few days of topical steroids, and obviously there are some products that cannot be used, and this is clear and recognized from the normal hair, and it is what you see after 3 months. Well, my last point, few words on minoxidil treatment. When, for how long? Well, in this paper, I'm happy to see that the first author is our chairman, Professor Andy Goren, and not everybody responded to minoxidil. Less than 50% responded to minoxidil, 38% actually. The problem is that we don't know who is going to do it, but Andy and others, they tried a very good test, and now, thanks to this analysis, which is using the sulfotransferase enzyme test, we can know with a 95.9% confirmation responding if androgenetic alopecia is going to respond in that case to minoxidil treatment or not. Then there have been other papers. You see, great names are involved with this kind of studies, and this kind of studies is probably the best. I think that my time is over, and I think that the rest has less to do with the hair. Thank you very much.